It's Charter Local Edition. I'm Brad Pomerance. We are coming to you from Washington, D.C., and we are joined by John Barrasso. He is a member of the United States Senate representing the state of Wyoming, also a medical doctor, an orthopedic surgeon. And so I especially want to speak with you about the Affordable Care Act, and really focus on Wyoming and how the Affordable Care Act is rolling out in your beautiful state.
Well, Brad, thanks. And you know, we need health care reform.
Yes.
So patients can get the care they need from a doctor they choose at lower cost. That's why we did this in the first place. But the president's health care law hasn't done any of those things and actually has made it worse in Wyoming, whereas an orthopedic surgeon taking care of patients for many, many years, I continue every weekend at home to hear stories from people who've been actually affected in ways hurt by the health care law. We had over 3,500 people who got cancellation notices because their policies, which worked for them, for insurance, the president said weren't good enough for him.
It's very interesting you say that, because that has been one point of contention that has stuck. Healthcare.gov, they fixed it. We knew they would. But when you talk about if you like your plan, you can keep it, that wound up being not an accurate statement. At the same time, though, could one argue, and I really want to ask you because you are a doctor, that the plans that were canceled were so substandard that it really was to the benefit, to the advantage of the insured, to get a plan that was going to really insure them in an appropriate way?
No. The letters that I've been reading on the floor of the United States Senate, one from a ranch family that had insurance that worked for them, the woman said, why do I have to have maternity coverage? She lost her insurance because she didn't have maternity coverage. Well, she's had a hysterectomy. And she said, Dr. Barrasso, please tell the president that once I've had a hysterectomy, I'm not going to have any more babies and I don't need to have that insurance.
A young man.
Same thing.
Not going to be able to have babies.
With no children, having to provide pediatric dental care, pediatric ophthalmology care. So what's happened is this basic level that the president talked about is really Washington demand, high level of insurance. People are having to buy insurance for things they don't need, they don't want, they can't afford, and they're never going to use.
So what's the answer? I mean, here we are today, 4 million people have signed up through the Affordable Care Act. In many states we have had the expansion, and so millions are seeing their insurance come through Medicaid through the expansion, not Wyoming as an example. Where do we go from here, though? I mean, to completely unravel the Affordable Care Act, I think many of the members would say would be challenging, to say the least. Are there fixes that can be made on a bipartisan basis?
Well, I want to work together with others, and you mentioned the key word bipartisan. I had a number of proposals we brought to the president to actually work on patient-centered care. Put the patient in the center of this, not either the government or the insurance company, but the patient. And the president rejected all of these. Remember, this was passed on single-party line votes in the House as well as in the Senate. So I say, let's go back. We can't go back to where it was before, but we need to go to a bipartisan approach to say, where do we need to go so patients can get the care they need from a doctor they choose at lower cost?
But is the environment ripe for that? And I ask you especially because you are a doctor. I mean, if anyone can talk intelligently, it's yourself. So can you speak with your Democratic friends in the Senate or in the House to get to a place, you may have a vote coming up, so we'll see in a second, but to get to a place where we can really make this work? Because there's just a lot of frustration out there.
There are members on both sides of the aisle that want to do that. The president is very reluctant. He has dug in. Any changes he's making, he's doing so unilaterally with different announcements. He's been over 24 times. The president has changed the law so that people don't see how bad it's really going to be once it's fully implemented. He did it again and continues
in terms of delays with mandates for businesses, as an example.
And what he won't get rid of, though, is the individual the individual mandate that says everybody has to prove to the IRS that they have insurance that's the president's insurance.
His name is John Barrasso, Senator from Wyoming. I'm Brad Pomerance. Thank you for watching Charter Local Edition.